All right. All right. Thank you so much for joining today. Today we're going to be talking about this health perception survey that was carried out by WIN International in collaboration with Gallup Pakistan. WIN International is the world's leading association in market research and polling, and it publishes this annual World Survey. This was published in 2021, which explores the views and beliefs of approximately 33,000 individuals among citizens from 39 countries across the globe. And on International Health Day, WIN releases the latest results of the survey to understand health self-perception and related habits. My name is Mishalle, and I'm joined by my colleague Laila today, and we're going to be talking about the results from Pakistan and also be comparing them with the other countries across the world. Just to give you a little bit of background about myself, I work as the manager programs and outreach at Public Health Pakistan. I have a background in economics and finance and international development policy. I've been working in the development sector for about 4+ years. So Laila, if you can just introduce yourself, that would be really great. And then
Yeah, thank you. I'm Laila Waqar, and I got my bachelor's degree in economics from LUMS. After that, I worked with the KP government on the health policy before briefly switching towards corporate sector, but now I'm with Gallup Pakistan, and I've worked on the previous health, climate, gender polls for the WIN survey. So I think we should delve deeper into the presentation and start with it.
Great, sounds good.
Yeah.
So it's interesting. We've got a couple of questions that were asked across different countries and also with using different parameters as well. And if we just look at the first one, which is how do you consider your overall health in general, we see the global average stands at around 59% for people who consider themselves to be healthy, and if you look at the variation from like 2020 to 2021, this percentage has remained roughly the same. And it's interesting because we were in a global pandemic, during that time. So I'm very curious, how people thought that their health was, very, or they consider themselves to be very healthy, during this time. And I'd have imagined, there would have been some kind of variation in the level of, at least this percentage. But maybe people were putting more effort into remaining healthy. That's just obviously speculation. You can see there are differences by, gender and by age group. Roughly, people who are younger, or actually the variation is not that much if you see across the age group. And I think it's the same for gender as well, 59% for women and 60% for men who consider themselves to be healthy. And if you move towards Pakistan, so it is a little below than the global average, but again, I do think, that is a big percentage of people that do consider themselves to be healthy. This is higher for people who are in a younger age group. And generally, if you look at the differences between men and women, you can see that men consider themselves to be more, healthy. And this could also be attributed to, I do think in Pakistan, those, variations might take place where men are exercising more or along the lines of that, I guess. But there is a very small percentage of the population that considers themselves to be unhealthy. If I were to personally ask myself, I do think, in 2021 or even over 2020, I do think that COVID might have, compelled me to really take care of my own health. So I feel like maybe that might be one of the, contributing factors to why people reported higher levels of being healthy during that time. So I think, yeah. So I think we can move on to the next question. And, oh, so actually, I do want to talk about a little bit about, what this looked like for different countries across the world. And so you can see, you've got a few countries that are at the top when it comes to health self-perception. And Pakistan is one of them, surprisingly, for 2021. And that's really interesting. That a lot of people in Pakistan reported that they consider themselves to be really healthy. And
Trend has stayed relatively stable for 2020, like post-COVID and almost like for 2021. But I'm seeing that a lot of countries, the self-perception has worsened for the 2-year period from 2020 to 2021. So I think we have like a few countries in that list who would say that the self-perception has improved post-COVID. That's a very interesting thing to note over here, though.
Yeah. So there are that actually makes more logical, I guess, sense, that how, the health would have changed over those 2 years. So it's interesting to see, that there isn't any variation in some countries. And like I
Yeah.
said, if you look at the, comparison from the last 3 years, we've still got Pakistan that was, at the top three for 2 years. And then before that, in 2019, we don't have Pakistan in the top three. That's also very interesting to note. And then you've got countries that have had variations, at the bottom level, and they're belonging towards, if you look at Hong Kong, Chile, Poland, they are consistently in the bottom three levels of health self-perception. And it's interesting that the highest level of they're considering yourself to be overall healthy is in Africa as well. I'm not entirely sure, why that may be the case. Are people exercising there more? Are they eating better? So I think those are also questions or those are specific characteristics that we might look at further in the presentation as well. So I think we can move forward.
Yeah. So I think the next question is how many people consider themselves to be eating healthy or they're meeting their global nutritional requirements. So what we see here is like for Pakistan, the statistics are 84%, while for like global statistics are 67%, which puts Pakistan 17% higher than the global average for people who consider themselves to be eating healthily. This is interesting because for a developing country like Pakistan, I felt like probably it would be somewhat similar to the global statistics, but it's 17% higher. So I think that will be an interesting aspect to look at as to why people think that they're eating healthily in Pakistan. So if you look at the country breakdown for some of the neighbors and the world powers, for Pakistan, as I said, it had the highest at 84%. But for Kenya, it's 68, India 42, United States 19, United Kingdom 15, and for China, it's 4%. I feel like the statistics for China are very interesting to note because only 4% of the respondents feel that they eat well. Like they're a superpower, they have the economic power capacity to provide for their country. So is it like the lifestyle is such that they're not able to eat healthy? Is it affordability or is it time management or generally the culture that they're not able to take care of their nutritional requirements? So I feel that the lowest statistics for China should be something that is interesting to note over here. So for Pakistan, between males and females, 85% of males as compared to 77% of females consider their nutritional requirements to be met. So I feel, that's not a very surprising aspect to look at, where males generally, like as you said, that they feel that their nutritional requirements are met more. Is it because of their biological needs that obviously male metabolism is faster and they require more nutrition to sustain themselves, or is it because of the cultural or the dynamics in play? So, for example, females, they usually tend to not look after themselves and their health withers with time. So those aspects could be interesting to note over here. So if we move forward with income breakdown, we can see that not surprisingly, the higher the level of income, the more people say that they're able to take care of their nutritional requirements. That makes sense because obviously they're able to afford more of the food and quality of food for their household. So with age, we see that, both young and the old respondents believe that they're able to eat healthily. However, if we look at the statistics overall for 18 to 24, 25 to 34, they're relatively stable. We say like 59, 57, 58. But there's a drop for the age group of 55 to 64. This was kind of important to note as to why people in this age group specifically think that they're not able to eat healthily very often. obviously we can like we'll have to dig deeper and see why this age group specifically feels that way. Because if it had been like, slightly older or slightly younger, maybe there could have been some explanation. But this was one of the interesting aspects to look at.
You also feel
Okay.
like, this statistic was for 2021, right? And there's, not particularly that much difference in the age group levels. And do you feel like,
Yeah.
because in recent years, generally people have moved towards like eating or adopting like healthy eating options? Because
Yeah.
I feel like a few years ago, if the younger you are, you're not very concerned about eating, very well, or looking after your eating needs, or at
Yeah.
least not or have a habit of looking after your eating needs that well. So I'm just wondering if that has something to do with, how trends might have changed in recent years and people have, moved towards healthy options.
It could have been because of COVID also, because we know from statistics that initially the older age group were the most worst hit by COVID as compared to the younger generation. So could that have been a reason for the post-COVID complications within these age group people, that they might have perceived themselves as to be not eating healthily for the older generation? So I think that's interesting to note over here. Okay, so sleeping well. This was another question that was asked during the survey, and for Pakistan, the statistics are people who sleep a lot or very well at night are 53%, and that's around 29% more than the global average of 24%. So if you look at the country breakdown, like Kenya, another developing country from the African region, is slightly more, has 58%, which is slightly more than the 53% of Pakistan, followed by India with 38, US 17, UK 14, and China again at 3%. So what we're looking over here is that like developing countries like Pakistan and Kenya tend to be rating themselves higher when it comes to sleep and nutrition, as opposed to the developing countries. And like it's interesting to note over here again that China, 3% of the respondents in China consider themselves to be sleeping well. So if we combine both the statistics for like the eating healthily was 4% and sleeping well was 3%. So I feel that maybe it's not about affordability or the lifestyle. But I think it's more about the lifestyle, because it's the general culture over there that they're maybe working more, or they do not have the time to look after themselves as much as they would like to do, and probably that's one of the contributing factors for China having such a low report on this one.
Mm.
So for the countries overall picture, if we compare between 2020 and 2022, both of them are slightly for COVID. Again, we can see a similar pattern that some have similar statistics and stability over time, but for some of them, the statistics have decreased. That they're not able to sleep well. Probably could have been COVID and prolonged COVID lockdowns and restrictions, and overall the dynamics of the country. Sorry, the world.
Mhm.
Okay, so for income, if we look at that, obviously with a higher level of income, people tend to sleep well as opposed to lower income brackets. It's not a very surprising fact, because obviously with higher level of income, you're able to provide more for the family, less financial worries. Could be a contributing factor as to why people sleep well at night. So if we divide it by gender, more males, 54% compared to females, 42% in Pakistan claim that they sleep very well, or a lot or fairly often. So I think maybe it could have been like two reasons for that. Could it be the double? Like, I don't know, but like, could we analyze this in the cultural context? I'm sure that we do not have a blanket explanation, and one rule does not apply for all of them. But females usually, if they're staying at home, they're working and involved a lot in child care or health care or just providing care. They're caregivers primarily in Pakistan, as opposed to men. So could that be a double burden for them? And if we analyze it, working women, they go to work, they work, and when they come back, they do contribute to the household chores or whatever responsibilities they may have. So, as opposed to, again, I'm not saying that that applies for all women, but I feel that a fair percentage of women in Pakistan do feel they go through similar experiences as opposed to men. So maybe that could be one of the reasons that they're not able to sleep as well as the males. And maybe if we can link it to the nutritional requirements, because male they were eating healthily, which could mean that they're taking care of their health more than the females. That could be, for example, anemia is it's said to cause disruptions in the sleep cycle. So maybe that could be one of the reasons over here. Okay, so the next is exercise.
Yes. So when it comes to exercising, again, Pakistan is ranking higher than the global average. This was a very interesting statistic. I do think, again, the trend has probably increased in 2021. I don't recall many people even around me considering exercising very frequently when we were, pre-pandemic times. So I think that might have been a contributing factor where people are now generally just looking after themselves, better. So and it's interesting to see that it's significantly higher than the global average. And it's also very interesting to note that 32% of the people say that they never exercise in Pakistan. So that's also significantly higher than the global average. So that you've got quite the variation in Pakistan just itself. When you look at countries from across the world, again, it's I think if you look at the first top three, that's just or top two at least. You in India, you've got that level that's going down. I do think that might have to do with the fact that in COVID, people were generally probably putting a lot more effort into keeping themselves healthy. There could be other reasons as well as to why, of course, there could be other factors as to why that level might be going down in some countries over those 2 year variations. I'm very, one of the interesting things was that if you look at the bottom, trends as well for different countries, Hong Kong is consistently ranking like lower, levels or reporting lower levels when it comes to these different questions as well. So I'm very curious what the culture or the economic situation or social conditions would look like over there, and what factors are specifically playing a role when it comes to that statistic. So if you move forward, we've got, and you look at the country comparison, Pakistan does report, at high level, the highest level of never exercising, and at the same time, we are reporting at the highest level of exercising as compared to the global average. While responding to China, Kenya, they do report exercising fairly often and frequently. So on the one hand, you've got in China, you've got statistics where they're not sleeping well or they're eating healthy, but they are putting a lot of effort into exercising. So that's again like an interesting correlation. Could there be some kind of correlation over there? If you look at different income groups in Pakistan, or at least people belonging to different income brackets, there isn't much variation when it comes to frequent exercising. I think it's roughly the same amount when you compare it to different income levels. And I feel like I don't particularly think you need, specific amounts of like income to exercise. You could just be going out, or you don't really need access to a gym all the time. So it's something that you could do within your own home as well. This was also a very interesting statistics where respondents in the 65 plus age group were, claiming to exercise more frequently. And I do think because as you get older, you are, your health generally would be worsening over time. So I feel like you are in a position to better take care of your health, or at least are more mindful of that. So this would, as opposed to when you're younger. So again, this was all very interesting when you look at the statistics of Pakistan.
Yeah. If we look at the statistics for people who report that they suffer from stress, we find that the global statistics are more than Pakistan. Like for Pakistan, it's 31% of the respondents who claim that they suffer from stress as opposed to 65% globally. That's a jump of like 34%. That's a huge gap if you're looking at the global average as opposed to Pakistan. So, is some of the questions that we can ask is whether Pakistan is generally happier than the rest of the countries, or the cultural dynamics are such that stress, as we know, if it's shared and if it's like social interaction is of such a level that they're able to help with the stress. So I think these are two of the aspects that we can look at Pakistan, whether it is the happiness index or whether it is the social mobilization or interaction with their peers and friends and family that leads to a lesser level in Pakistan. So for Pakistan, for the country breakdown, we see that the stress level is lowest for Pakistan. Like 50% of the respondents feel that they've never suffered stress. That's like significantly lower than like less than half of the other countries can claim that. So, for example, Kenya, 21% say that, 13% India, 11% UK, 10% United States, and again 3% in China claim that they never suffer from stress. So I think it's a very interesting aspect to know how like I feel like, if you've looked at all the comparisons so far, Kenya and Pakistan have somewhat of similar backgrounds and results as opposed to the other neighbors such as India or China, and then from the UK and the US. Similarly, like the stress levels have increased over time for some of the countries. It can be indicated by Croatia, Lebanon, Argentina, Philippines, and then Palestine, obviously because of their dynamics, and then Chile, UK, Finland, etc., etc. So again, is COVID a reason for this, or whether it's post-COVID, the layoffs that were there, or the health complications that were there, or the generally changing dynamics of the work culture, or overall the blow that COVID gave to our to the economies worldwide. So I think these are some of the factors that could result in enhanced stress levels in these countries. So for income levels, it can be observed that people from the lower income brackets suffered the most stress. Again, it could be a number of reasons for that. For example, finances is one of the reasons. Then post-COVID, the economy was worst hit and there was a lot of instability. So those could be one of the reasons that in Pakistan that was the case. Gender, again, more females compared to males in Pakistan report to be suffering from stress. If we tie this down to purely biology and psychology, statistics have proven that females are somewhat more susceptible to taking stress as compared to handling stress as opposed to men. So it has nothing to do with anything else, but like purely how our the neurons in our brains work, or anything like that. So it could be that, or it could be generally the emotional capacity to handle stress over time, or I don't know, it could be another economic reasons, because in the household generally the culture is such that the male breadwinner earns the money and gives it to the female. But with increasing inflation and then COVID, maybe managing the expenses was one of the reason, or losing a loved one due to COVID was one of the reasons for this disparity between males and females in Pakistan. So then the next one we have is smoking habits.
So again, Pakistan, like I was just talking about how they're reporting, significantly higher levels as compared to the global average for these different indicators. And 83% of the respondents, claim that they never spoke or smoked very little. And that's actually very interesting, because generally you do see a lot of people smoking in Pakistan, and at least around, if I live in Lahore, which is again a big city, and it's very, very common to see people smoking around you. So, and I would just, if you go, if you move towards more rural areas, I'm sure the trend is probably the same there as well. So it's interesting that this statistic specifically for 2021, where Pakistanis claim that they can never smoke or smoke very little. There could be multiple factors as to why this, percentage is this high. Again, it could be tied to, the fact that people are taking care of their health, they're exercising more. So, all those factors are kind of just contributing, or they're linked very closely to each other, I guess. If you move forward, we've got, we've got a comparison to different countries, and it's very interesting to see that respondents from the US, India, UK, they all consistently report high levels of like never smoking, and
Yeah.
but in a place like Kenya, you've got you've got people who do smoke very often, even though that percentage is generally lower, on the lower side. And generally, it's also, you can see that all these countries are reporting lower levels of like smoking, or fairly often, or like very frequently as well. So generally, I think there could be an aversion to smoking, especially given that it harms your health. And in COVID, people were very particular about taking care of their lungs, because that was one of the organs that was being particularly affected. So and then if you look at different countries across the world, you've got variations from 2020 to 2021. This percentage has gone up for some countries. You can see in, say, for example, if you look over here at Lebanon, Turkey, or, Serbia, or sorry, not Turkey, but Poland, or, countries in that region of the world, you can see that, the statistic has gone up post-COVID. So that's also like very interesting to note, that maybe generally people were like, okay, they've gotten used to the idea of COVID now. So this again was for Pakistan. I do think generally, as you are older, or at least I've noticed in the people that around me as well, that respondents in a higher age group are, reporting high levels of smoking, and or smoking very frequently, and I'm not sure what that could particularly be, attributed to. Be it could be attributed to your that you've reached in a retirement age, or you are
Probably, I think culture within Pakistan also, like if as you grow older and if you have a certain social circle, and if somebody in that social circle is smoking, probably you will pick up that habit. But I think that's more likely to be true for any age group in that matter.
yeah.
But like but for the younger, for example, especially in Pakistan, like you would parents would generally not be so willing to openly accept their child smoking, or there will be some resistance for that. But as you grow older, your children are all grown up. You're probably not accountable to anyone. This could be one of the reasons as to why this may happen, but we could have a plethora of other options for that also.
Yeah, definitely.
Yeah.
So I think that probably concludes the end of the questions that we had for this survey. And
Yeah.
if you want to move back to the previous slide, we can just look at
Yeah.
the overall regional comparisons for all these questions, and you can see that people in Africa again are reporting the highest levels of eating healthy, and
Yeah.
uh,
Keeping well also.
and yeah, exactly. And not that Asia Pacific is far behind, but again, it's incredibly high for Africa. That's very interesting. I do think COVID was ravaging through Africa, and Africa was probably one of the last regions to get access to vaccines as well. So it's interesting that maybe that's why they were compelled to look after themselves better. So because they had access to that.
Relation between like all these factors also. For example, if you're reporting to be eating well, sleeping well, exercising, then automatically you'll have lower level of stress, because we've known that exercising helps reduce stress. So I think that could be one of the reasons. But I was also thinking about how how they perceive themselves to be like, for example, even if a person is sleeping 8 hours a day, but they think that maybe they're not getting enough sleep or they're not getting a peaceful sleep at night, probably that may have altered the results a bit, as opposed to how they perceive certain things to be versus how they think things are in reality. Maybe cultural dynamics have a say in this, maybe gender has a say in this, but like I feel like, whatever the case may be, there is definitely a correlation between all these factors.
Yeah.
Especially results for Africa are really surprising, because I felt that people would be more stressed if they do not have the opportunities or the economic opportunities in the country, as opposed to, for example, America or Europe. But we see a completely opposite trend over there.
Yeah.
And,
Yeah.
that's something to note. Yeah.
Yeah. So I think that probably concludes the end of our discussion for this wind survey. And it was very, very fascinating to go through all these statistics and also just see the comparisons for different countries and evaluate them on different factors, such as income levels or age group or other gender. So I think I really enjoyed looking at or evaluating those results.
Nice discussion, and thank you for having me for this talk. And I feel like maybe in the future we'll have similar talks and increase our knowledge back. Thank you very much.
Thank you so much, and take care. All right.
Hello.